Calendar a meeting with your primary care physician when you discover you're pregnant. Your primary care physician will begin by checking on your clinical history. The individual additionally will need to think about your side effects. During this first arrangement, pee and blood tests will be taken. These will likewise be taken again on later visits. Urine tests check for microscopic organisms, high sugar levels, which can be an indication of diabetes, and high protein levels, which can be an indication for preeclampsia, a sort of hypertension during pregnancy. Blood tests check for platelet tally, blood classification, low iron levels, sickliness, and irresistible infections, for example, syphilis, HIV, and hepatitis. The specialist likewise may do different tests at your first visit. These may change dependent on your experience and hazard for issues. Tests can include a pelvic test to check the size and state of your uterus, belly, a pap smear to screen for cervical disease, a ultrasound to see your child's development and position. A ultrasound utilizes sound waves to make a picture of your child on a video screen. After your first visit, you will have a pre-birth visit at regular intervals. In months 7 and 8, you will have a visit at regular intervals. In your last month of pregnancy, the visits will happen week after week until you convey your child. At each visit, the specialist will check your weight and circulatory strain and test your pee. The specialist will tune into your child's pulse and measure the stature of your uterus after the 20th week. You ought to consistently talk about any issues or concerns you have with your primary care physician.